All right. Hello, and welcome, everyone. Thank you so much for showing up this evening or afternoon or morning, wherever you are tuning in from. Today, April 21st, is National Vulva Awareness Day, which was a day that was actually created last year in 2022 by SweetSpot Labs. SweetSpot Labs is an incredible ally to the LS community. And this day is really for us to, bring attention to, raise awareness around, and educate ourselves around the vulva and all that that entails. So today we are going to be doing some vulva education and awareness, and that's going to look like me kind of walking us through some, vulva 101 kind of anatomy, a little overview course, if you will. And then after that, we're going to have an appreciation piece. And that's going to involve some gentle yoga, some gentle movement and meditation practice centered around the idea of fostering compassion and self-love for our vulvas. Now, you probably received our newsletter announcement today, and if you follow me on social media, you probably saw it in my stories. But unfortunately, Penny is very, very sick and unable to join us in person tonight. So for the appreciation piece, we're going to play a recording of that practice, that appreciation practice, and that's going to be the second half of today's event. So with that, let's jump into some Vulvar Anatomy 101. So I'll make my slides bigger here for everyone. All right, so a quick disclaimer, or disclaimers, I should say. Jaclyn and Penny are not medical doctors. They cannot and do not provide medical advice or engage in the practice of medicine. The information provided in this event is for education and entertainment purposes only and does not, under any circumstances, constitute medical advice. Please consult with your healthcare providers before making any changes to your healthcare plan. And disclaimer number 2 is that the next couple of slides are going to be illustrations of vulvas. So these are not necessarily real human vulvas. Unfortunately, we are still not able to show those, but we are working on upgrading our platform so that we can show them. There will be illustrations though, so that is your warning. And the next slide is going to be a vulva. So this is a vulva. Let me pop myself up on the screen here. So this is an image of a vulva. Now, a lot of people always ask me, like, what's the difference between a vulva and a vagina? And I always tell them the simplest way to remember is that the vulva is the external genitalia. So vulva outside, vagina inside. That's the way I like to describe it. So this in front of us now is the external genitalia of the vulva. This includes the Mons pubis, the clitoral hood, the clitoral glands, the labia majora and minora, the urethral opening, the vestibule, the vaginal opening, the perineum, the fourchette, and the anus. So we're going to go through all of those different parts. We're going to talk about where they're located, what their function is. And this is really important because a lot of folks are starting to get good on vulvar anatomy, but they're not really sure what our parts are there to do. So we're going to talk about function, and we're also going to talk about how these parts can be affected by lichen sclerosus. So we're going to start up at the top, which is the Mons pubis area. So if you can see my cursor, I'm kind of moving it over that area. Now to see the Mons pubis, if you are standing straight in front of a mirror and you are naked, the Mons pubis is that area between the hip bones, and it's kind of going to look like an upside down triangle. So that upside down triangle area in between those hip bones, that is your Mons pubis. Now the Mons pubis is covered by fatty tissue that lie on top of the pubic bones. And the purpose and function of the Mons pubis and this fatty tissue is to help protect those pelvic bones during sexual activity. So does lichen sclerosus affect the Mons pubis area? It's not a very common site for lichen sclerosus, and it's not a site that's really discussed much in the medical literature, but anecdotally, I know of quite a few people who have lichen sclerosus in that area. And what that can look like in the Mons pubis is itch and sometimes soreness. And then there can also be skin changes such as hypopigmentation, which essentially is just a lightening of the skin. So whatever that kind of baseline color is that you have, it's going to appear lighter. And then there can also be texture changes. So the skin might appear thicker, or it might kind of look like wax paper. So that can kind of happen up in that Mons pubis area. The Mons pubis is normally covered in pubic hair, unless, of course, you choose to remove your pubic hair. After the Mons pubis, if we go down a little bit, we have the labia majora here, which again, I'm moving my cursor around and hopefully you can see that. These are often referred to as the outer lips of the vulva. And the labia majora, like the Mons pubis, also contain a fatty tissue. Now the labia majora basically start around the Mons pubis area, and then they extend all the way around about an inch or two above the anus. During sexual activity, these labia majora can swell and become engorged when you are aroused or doing sexual activity. And the main function of the labia majora is actually to protect other parts of the vulva, such as, for example, the vestibule, which is this area here, very, very, very important area, which we're going to be discussing shortly. Now, lichen sclerosus can sometimes occur in this area. It doesn't seem nearly as common as other parts. Again, this is an area that there's not really a lot of literature that talks about lichen sclerosus in this area. But again, anecdotally, I have heard of people having it here. And if you have symptoms here, it can look like pain or itch. And I just want to say a basic disclaimer for this. When I use the term pain, I'm very much using this as an umbrella term for any type of pain. So it might be burning pain, it might be stinging pain, it might be throbbing or aching, it might feel like a rug burn or a sunburn. I'm using that term pain to kind of cover all of those different types of pain presentations with lichen sclerosus. So again, pain and itch can occur in that area, and then you can also have changes to the color, usually a lightening of the skin, and then a change to the texture of the skin. Usually this area is covered in pubic hair, again, unless you choose to remove your pubic hair. And obviously in this illustration, there is no pubic hair. The labia majora comes in all different shapes and sizes, all of which are beautiful. Moving in from the labia majora, we have the labia minora. So the labia minora are known as your inner lips. They're commonly called the inner lips. And unlike the majora and the Mons pubis, the labia minora, those inner lips, they do not contain that fatty tissue, and so they can often appear thinner than the labia majora. Now, like the labia majora, the labia minora can come in all shapes, colors, and sizes, again, all of which are beautiful, all of which are valid. Now, on the labia minora, there are actually small oil glands, and you may or may not be able to see these glands. Personally, I've tried very hard to see where they are on me, and I can't physically see them. But if you are able to see them, they're kind of going to look like tiny little yellow dots or raised pink bumps. And those are the oil glands that are on the labia minora. Now, these oil glands are completely benign, which means they are normal and they are healthy. But as always, I always tell folks, if you see something on your vulva and you're not sure what it is, always best practice to just call up your doctor, get a clinical examination, and just have them make sure that what you're seeing truly is benign. My personal philosophy is I'd rather just be on the safe side, right? That just makes me and my anxiety feel a lot more comfortable. So the labia minora can act to protect the urethral opening and the vaginal opening. And they also play a role in arousal by spreading the lubrication from those oil glands to around the vulva in general. Now, like the labia minora, like the labia majora, the labia minora can also swell and grow in size. They become engorged during sexual activity due to an increase of blood flow to that area. Now, the labia minora can definitely be impacted by lichen sclerosus. Again, there can be pain and itch. And now, interestingly, some folks only have those symptoms on one side of the vulva. So maybe the left or the right labia minora feels symptoms, but the other side doesn't. That can be present in a lot of individuals. Other than that, you can absolutely have both sides. For me, both sides were affected by pain and itch. And then, of course, the labia minora can also change in color. So whatever your baseline color is, they can start to lose pigmentation and they'll become lighter. Another thing that can happen is skin texture changes. Again, there can be areas of thickened skin, or it might become like wax paper. The texture of the skin will change. And then another thing that can happen with the labia minora is that it can actually start to fuse to the labia majora. So I'm going to bring myself up bigger here for a second because I want to illustrate what goes on in fusing. So I have my two fingers here, my index finger and my middle finger. We're going to pretend that my index finger is the labia minora and that the middle finger is my labia majora. Now, normally, you can kind of move these two parts and separate them with relative ease. But what can happen with lichen sclerosus is the skin starts to change in texture and starts to become sticky and almost tacky, and they start to stick together. So when they're fused, I can't really pull them apart, right, as easily as I could before. It's kind of harder. However, if I were to take my index finger on my other hand and close my eyes, and if I take my hand and run it across those two fingers, I can very distinctly tell that I am touching two distinct pieces of anatomy. In this case, two fingers. In the case of our vulva, the labia majora and minora. Now, as the fusing progresses, which is something that can happen because lichen sclerosus is a progressive condition, so as it progresses and as that fusing progresses, it can sometimes result in something called resorption, which is essentially when those two parts become one. So that again, if I close my eyes and I take that index finger and I rub it across that area, now I'm only feeling one part of the anatomy. So it's almost as if that labia minora, that inner lip, just kind of dissolves and melts into the surrounding part of your anatomy, which is the labia majora. Now, this is actually what happened to me. So in my case, I lost the majority of my labia minora. It's completely resorbed into the labia majora. And I have just a little tiny bit of minora left up at the top here. So this is definitely something that can happen to folks with lichen sclerosus. And if you are interested in learning more about labial fusing and what's going on there and what can we do about it, and if you have questions about labial fusing or labial adhesions, as it's called more commonly in the medical community, just know that Lichen Sclerosus Support Network will be putting out content in the future on the topic of labial adhesions. So if you're interested in learning more about that, be sure to sign up for our newsletter. Kathy is going to put that in the chat box for you, so you can just kind of copy and paste that link. Be sure to tick off blog and video so that you can get updates for when new content becomes published, and then you can see it. All right, now we're going to move on to the vestibule area, which is this area inside here. So it kind of sits within the labia minora. So I'm kind of using my cursor again. Hopefully you can see it to kind of delineate that border. Now, there is something called Hart's line, H-A-R-T, and Hart's line forms the border around the vestibule and the labia minora. And now, Hart's line is something that, again, you may not be able to see physically with your eyes, and that's okay. It's not really a big area of concern for lichen sclerosus, but clinically, it is incredibly important because what that border is saying is that everything outside that border, the tissue is different, and everything inside that border, i.e. the vestibular tissue, that tissue is different. So everything outside the vestibule, the labia minora, the labia majora, the clitoris, the fourchette, the perineum, all that is made up of different tissue. So the vestibule is really unique in that its tissue is actually derived from the urinary system, which makes it, again, because it's a different tissue, it's actually more susceptible to irritation, inflammation, pain, and hormonal changes. Now, the vestibule, again, is an area that can be sometimes affected by lichen sclerosus. It's not really an area that has a lot of literature behind it, but I have heard, again, anecdotally of folks saying that lichen sclerosus is involved in that vestibule area. So my advice to you is that if you think that there is vestibular component going on here where there's vestibule pain and you're not sure, You just want to make sure that, there is no lichen sclerosus in that area. So you would want to have a conversation with your doctor about that. And another reason why you might want to have a conversation with your doctor, if you're experiencing pain in the vestibule area, this is actually a very, very, very common site for pain. And what you want to know is you want to make sure that the pain is coming from lichen sclerosus and not a secondary condition. Because something that happens to folks with lichen sclerosus, myself included, is that we often think that because we have lichen sclerosus, that all of our symptoms in our vulvar area are due to lichen sclerosus, but sometimes they can actually be due to secondary conditions. For example, it can be due to vestibulodynia, which is a very painful condition that occurs where there's pain localized to that vestibule area. So you can have hormonally mediated vestibulodynia, which is where the pain component is coming from hormones, or you can have provoked vestibulodynia, which is where there's a pain response when you touch that vestibular area. And the reason why people with provoked vestibulodynia experience that pain is that some folks are actually born with more nerve endings. And when I say more, I mean substantially more nerve endings in that vestibule area. And because they have more nerve endings there, they are more predisposed to experiencing pain and to developing provoked vestibulodynia. Now, the vestibular tissue has similar cells to the bladder and the urethra, and that is also why sometimes folks who tend to experience issues in the vestibule area also tend to have more urinary tract infections. And then there's this other component to the vestibule that's quite interesting, and that is when we are being kind of created in our parents' womb. So, different parts are starting to develop in the womb. The tissue of the vestibule and the tissue of the belly button are actually made from the same cells. So let's talk about what this means for a second. So I'm going to take myself and make myself bigger here for a second, and we're going to use my vulvar puppet. So if you have pain in the vestibule, which is, again, this area inside of the labia minora, if you have pain here and your doctor suspects that it's not lichen sclerosus, but something called provoked vestibulodynia, what they're going to do is a swab test. So they're going to take something like a Q-tip, right? And then they're going to gently touch different areas of the vulva to see if that creates pain. Now, if you are in a lichen sclerosus flare and your flare involves pain, then that probably will be painful too. If you're not in a painful flare, then there may not be any pain. But what they find is that when they start bringing the Q-tip close to the vestibule and when they gently, and I mean gently, touch the vestibular area, that creates a sudden increase of very sharp pain. And when I mean sharp pain, folks with vestibulodynia often describe it as feeling like a hot, searing knife being stabbed into them. So a very, very painful condition. And interestingly, when they're doing that test, the next step that a lot of clinicians will do, or at least clinicians at the Center for Vulvovaginal Disorders, is they will take their fingers and they will gently press on the belly button. And what they see is that when they press on the belly button, it actually elicits the same pain response in the vestibule because the vestibule and the belly button are actually made, again, from the same tissue. Now, the vestibule is also home to some other important anatomical parts, such as the urethral opening, the vaginal opening, and then some very important glands. So we're going to talk about the glands shortly, but we're going to start with the urethral opening. So the urethra itself is a structure that is found inside of the body, and it moves urine from the bladder outside of the body. So we can see, or you can sometimes see, the urethral opening, but the actual urethra itself, that part we can't see. So the function of the urethral opening is to help urine get out of the body. So when we're peeing, we are peeing out of our urethral opening. So as a quick side note story, I was talking to somebody the other day about this, and we were talking about how there's a real big lack of awareness about vulvar anatomy. And I was sharing a story how when I was in grad school, I was about 27, 28 years old, and I was, in a PhD program. I considered myself educated, and I was chatting with my fellow colleagues, and I said to somebody, oh, when you pee out of your vagina. And that person stopped me dead in my tracks, and they were like, what are you talking about? You do not pee out of your vagina. You pee out of your urethral opening. And that person took like a little napkin that was at our table, and then she took a pen out of her bag and started to draw a diagram of a vulva and explain to me that actually, no, we do not pee out of our vaginas. We pee out of this urethral opening up here. So does lichen sclerosus affect the urethral opening? This is a question that I often hear and that we often get at Lichen Sclerosus Support Network. So typically this area is not commonly affected, although it definitely can be. So when we talk about the urethra being impacted by lichen sclerosus, what can sometimes happen is that, remember how I was saying the labia minora can sometimes fuse outside to the labia majora? Well, in some cases, and again, it's not common, but this can happen, is that the labia minora actually fuse inward. So imagine there's a sharp line down the middle. They're actually fusing in towards the seam down. And what can happen is as they're fusing over that area, it can partially or completely fuse over that urethral opening, which is going to make urination very, very complicated. In that case, they do perform a surgical procedure to unfuse the labia minora from each other, opening that space up for the urethral opening so that you can pee again without any issues. Now, I have heard anecdotally, and I haven't read any papers about this yet, so if anyone listening has papers on this that they would like to share with me, I would love to learn more. But in terms of this area just kind of fusing on itself, I haven't read much about that in the literature. It's usually the labia minora kind of fusing, although I've heard a couple of people tell me that their urethral opening started to narrow and fuse over without the labia minora implication. So what I always tell people is that if you think that lichen sclerosus is affecting the urethral opening, it's very, very important to seek out a specialist to get that evaluated to see what next steps are going to be. Now, the best kind of specialist to see if you're having a urethral issue is going to be a urologist or a urogynecologist. That would be the #1 recommendation for if you have potentially a urethral component to your lichen sclerosus. So next up, we're going to talk about some important glands. So up at the top here, we have Skeen's glands, and we have one on either side of the urethra. And these glands are, these glands are a little bit controversial insofar as there's not really a lot of consensus in the medical literature about their function. So there is a group of people who believe that the function of these glands is to secrete a substance that coats the urethral opening. And then some believe further that that substance that's coating the urethral opening actually contains antimicrobial properties, which helps reduce the likelihood of urinary tract infections. But again, take that with a grain of salt because that's not really been, conclusive in the medical community. Now at the bottom, so next to on the right and left side of the vaginal opening, you have something called Bartholin's glands. Now Bartholin's glands are about the size of a pea, so they're quite small, and you're not going to see them. Similar to the Skeen's glands, you're not going to see them, and neither the Skeen's glands nor the Bartholin's glands are affected by lichen sclerosus. Now, the function of the Bartholin's glands is to basically secrete a mucus-like substance that will coat the vagina and the labia minora. So they almost help to act as a natural vulvar moisturizer to help reduce friction and irritation. So again, you can't really see these glands typically, and they're not affected by lichen sclerosus. However, there's a really important reason that I wanted to discuss these, and that is that while they're not affected by lichen sclerosus, what can sometimes happen is these tiny little glands, they can get filled with fluid. So fluid starts to back up in that gland so that it grows and swells in size. And the result can be something called a Bartholin cyst, which I'm going to show here. So this is a picture of a Bartholin cyst. So we can see here that once upon a time pea-sized gland got really, really large. And what happens is with that fluid that's backing up, sometimes that fluid can become infected and that can cause an abscess. Now, if you suspect that you have a Bartholin cyst, it is very important to seek medical attention and get an evaluation, because if the fluid is infected, they may prescribe antibiotics and need to surgically drain that cyst. More often than not, though, conservative measures at home are more than enough to kind of get the cyst to calm down. Now, there's a reason I bring this up. I spoke to an individual a while ago who had a Bartholin cyst, but initially she noticed a bump. So remember how normally you can't see it, but when it starts to swell and grow, you might be able to see it on the vulva. And she noticed the swelling and some pain and discomfort, and she assumed that it was lichen sclerosus. And so she kept putting steroids on it every day, more and more steroids, and it wasn't getting better. And she was very concerned and couldn't figure out why this wasn't improving. So she was very distressed. And finally, she went to the doctor, who told her, no, this is not lichen sclerosus, and therefore it's not going to respond to steroids. You need to treat this way instead. So the important lesson here is that it's so important for us to know our vulvar anatomy, to be educated about vulvar health, and to be educated about lichen sclerosus, but also other conditions that can occur down there, because we can get secondary conditions. And the best way that we can advocate for ourselves and get quality care is to be up to date on vulvar anatomy and vulvar health. So keep in mind that this is something that can occur and that can be treated more often than not with conservative measures at home. Okay, so let's move on to the vaginal opening. So the vaginal opening is found at the base of the vestibule below the urethral opening. Now remember with the urethra how I said you can't actually see the urethra itself. The urethra is in the body. Same thing for the vaginal opening. We can see the vaginal opening, but we can't see the vagina itself. So the vaginal opening is, again, here at the base, and the main function of the vaginal opening is to help with sexual intercourse and reproduction. Now, the vaginal opening so the vagina, by the way, is typically not affected by lichen sclerosus. In fact, most doctors that I have heard speak say that lichen sclerosus does not affect the vagina. It affects the vulva, not the vagina. Now, a couple of doctors will say that there have been a couple of case studies where lichen sclerosus did affect the vagina, but for the most part, there's consensus that it really doesn't affect the vagina, but instead it affects the vulva. However, lichen sclerosus can absolutely affect the vaginal opening. So let's talk about that. So in terms of symptoms around the vaginal opening, again, people can experience pain and itch. There can also be skin discoloration there, so that hypopigmentation, that lightening of the skin can occur, as well as skin texture changes. But another thing that can happen is a lot of people find that they tear a lot in this area with insertion. So again, with insertion, I'm using this term very, very broadly to encompass insertion of a speculum, a tampon, a finger, a toy, a penis, etc. So very, very broadly understanding that term insertion. So when something is inserted into the vaginal opening, it can kind of tear. So I'm going to switch to the next slide because the vaginal opening is a bit bigger here, and I want to show you what can happen to the vaginal opening because we get a lot of questions about this. And just for your information, this slide is labeled introitus. That is a different word for the vaginal opening. So it might be called introidal opening or vaginal opening, depending where you're reading, but they are referring to one and the same thing. So here we have the vaginal opening. Now what happens is that you can sometimes tear at the base of the vaginal opening. And when you tear, what can happen is as you heal, scar tissue forms. And for folks like myself who repeatedly tear in that same location, a lot of scar tissue can start to build up and form in that area. And what can sometimes happen is it's forming at the base. And clinicians and a lot of patients that have this will explain it in the same way. They say it looks like there's a shelf of scar tissue sitting at the base of the opening of my vagina. So that vaginal opening has a shelf of scar tissue. And let's say it takes up about a quarter of that space. That means that there's less space. So they call it narrowing of the introitus or narrowing of the vaginal opening. Because of that scar tissue, there's less open space. And that can make insertion very difficult and also very painful. Now, if you do have that buildup of scar tissue at the base of the vaginal opening, there is a surgical procedure that can be done to remove that scar tissue and open the vaginal entrance again so that there is more space so that it is not nearly as painful. All right, let's go back to this slide here. So we're going to move down to the fourchette and the perineum. So the fourchette is located below the vaginal opening, and it's this kind of fold of skin that we can see here. Now, the main purpose or function of the fourchette is to allow stretching and opening during sexual intercourse as well as vaginal birth. Now, the fourchette is definitely an area that can be impacted by lichen sclerosus. In terms of symptoms, again, we're talking itch and pain. In terms of skin changes, the texture can thicken, or again, we can get that wax paper appearance, and it can also lose pigmentation, so become lighter. This is also an area that for a lot of people tear in this area. So for me, when I used to tear with insertion, I tore a lot at the vaginal opening and the fourchette. Whenever I talk to people that really experience a tearing component, they talk about the fourchette and that, vaginal opening. So if we go below the fourchette, we have the perineum. So the perineum is that stretch of skin that goes from the fourchette all the way down to the anus. And the perineum functions very similarly to the fourchette insofar as its role is, again, to help that area stretch to enable vaginal birth. It also acts as a foundation for our pelvic floor. The perineum, just like the fourchette, can also be impacted by lichen sclerosus in terms of symptoms. We have itch and pain, and then again, there can be skin changes. Right below the perineum, we have the anus, which I know technically is like not the vulva, but if you look at images and like kind of illustrations of vulvas, they always include the anus. So I want to talk about the anus just because there's not a lot of information about perianal lichen sclerosus. It doesn't get nearly as much attention as vulvar lichen sclerosus, and you can absolutely get lichen sclerosus in the anal area. So the function of the anus is to help you have bowel movements, so to go poop. And there are nerves and muscles that surround the anus, and those nerves and muscles basically help tell us that, hey, it's time to go to the bathroom, and those nerves and muscles also help us keep that in our bodies until we're able to go to the bathroom. So let's talk about how the anus can be affected by lichen sclerosus. So anal lichen sclerosus is very similar to vulvar lichen sclerosus in terms of signs and symptoms. Symptoms in the anal area can involve itch and pain. There can be fissures, very, very uncomfortable. And then again, we can have skin changes like a lightening of the skin, and the texture can change as well. It can thicken or become like wax paper. Now, it is possible to only have lichen sclerosus in the anal area. So some people just have it around the anus. Some people just have it around the vulva. And then some people have both vulvar and anal lichen sclerosus. When you have lichen sclerosus in both the vulva and the anus, that is usually what they're referring to as that classic figure of 8. So it basically, that classic figure of 8 starts up at the top around the clitoris and goes down the labia majora and then kind of circles around the anus and then comes back up on the other side of the labia majora up at the top. So it kind of forms that 8. So you'll hear a lot of doctors talk about the classic textbook presentation. You're not hearing it as much anymore, and I think it's because doctors are starting to realize that lichen sclerosus really does present visually differently on every kind of person, right? So it doesn't seem to be like one specific look anymore. It seems to be more diverse. So that is kind of, what can happen in that anal area. I will say that if you have symptoms in the anal area and you're not sure if it's lichen sclerosus, again, this merits a conversation with your healthcare provider. We really want to make sure that it is, in fact, lichen sclerosus before putting steroids on that area. Again, just get that confirmation first and then treat accordingly. All right, so we've reviewed most of the parts, but I saved the best for last. The best for last being the clitoris. So the clitoris, the main function of the clitoris, this is our sensory organ. This is responsible for sexual pleasure. So it is Vulva Awareness Day, and the vulva is an external genitalia. But actually, and I only learned this, a few years ago, that what we can see externally of the clitoris up here is really just the tip of the iceberg, right? This is what the actual whole clitoris looks like, because the majority of our clitoris we actually can't see. It's below the surface. So this is actually what our clitoris looks like. Now, this blew my mind when I first saw it, because I had no idea that the clitoris was this big, that it was this expansive. I always thought it was this teeny tiny thing up at the top, and that was it. So this really expanded my mind, and we'll talk more about that in a bit. But so we have the glands up here, and this is what you can see. And then under the surface, we've got the corpus cavernosum here, the crura here, and then the vestibular bulbs. They kind of sandwich between the vestibule area. And so they kind of sit between that area, and then you have the urethral opening up at the top, and then the vaginal opening up at the bottom. So when we go back and we're looking at this image, we can see that, wow, we actually can't really see much of our clitoris. And this is going to be really important in a couple of minutes as we kind of dive deeper into clitoral anatomy. So we're going to mostly focus on the external clitoris today. But if you are interested in learning more about the clitoris, and maybe, I don't know, if you want us to maybe do an event on the clitoris in the future, maybe we'll bring in a clitoral expert to kind of take a deep dive into the internal and external components and really dive deep, and so you can ask the experts questions. Let us know. We'll put that on future plans, and hopefully we can get that set up for you. You can feel free to share that in the chat. Kathy is our moderator, and she is in there looking out for your comments. So let's discuss the external part. So the external part of the clitoris involves the clitoral hood, which is this part here, and then the glans clitoris, which almost looks like a teeny tiny grain of rice. It's very, very small. And the size can vary per body, by the way. There are some people who have bigger clitorises than others. Some people have smaller. Again, totally okay, totally normal. Let's talk about the clitoral hood. What is the function of the clitoral hood? What is the purpose? Well, the purpose of the clitoral hood is actually to reduce friction and irritation. So if you were to remove that clitoral hood, what you would be left with is the glans clitoris. Now, the glans clitoris, that's where all the sensation really is. Well, not all, it's actually everywhere, but there's a lot of sensation in that glans. That glans contains thousands of nerves. And if you were to peel back that hood or remove that hood, that glans would be fully exposed. And you would experience basically overstimulation. And it would actually become incredibly painful. That is not something we want. So that hood is actually very protective. And that hood is actually very, very important. Furthermore, that hood, and I'm going to bring myself bigger for a second, bring my vulva puppet back. So at the top here, this blue here is going to be the hood, and this pink is the glans. So the hood also secretes a substance that kind of acts like a lubrication that helps move the hood so that you can kind of glide it easily over back and forth of the glans. So that lubrication, again, is very important. Now, as you become aroused and engaged in sexual activity, the glans can actually become more engorged and grow in size. And as that glans grows in size, the hood will slightly retract and expose more of the glans. Again, this is assuming that you're not fully fused. If you're fully fused, you're probably not going to see the glans, but if there's no fusion or minimal fusion, then as it pulls back during arousal, you'll see more of that glans. And that is a good thing in the context of sexual activity, because that means we're going to feel more sexual pleasure. So that is a good thing. Let's bring this back up here. So for people with vulvas, the clitoris is the main site of orgasm. This is where most people with vulvas will experience orgasm. And most folks require clitoral stimulation in order to orgasm. Now, I want to just say a little something here, and I'm going to bring a prop in a second, but most people think that to orgasm or to get clitoral stimulation, you need to directly stimulate the clitoris, this external part. But remember that this little part here is one very small part of the clitoris. The clitoris also extends all the way down here, and we have the vestibular bulbs here. So for people with lichen sclerosus, if the clitoris is sensitive, if the clitoris is painful, and by the way, some folks without lichen sclerosus have clitoral hypersensitivity and don't like their clitoral glands being directly stimulated. What you can do is you can take like a vibrator like this that has a really wide head, right? We can see this is very big. It's not like a bullet, right? A bullet is kind of the size of this. So you take a toy that has a very broad head, and then you can take that, and instead of applying it to the clitoris glands directly, you can rub it over the majora and minora, because you're actually stimulating that internal part of the clitoris indirectly. So this, to me, was something that really blew my mind when I kind of learned how big the clitoris was. I realized how much more expansive orgasm and pleasure can be, because again, a lot of people cannot tolerate direct stimulation to the clitoris up here, but if you're moving it along this area, you are kind of indirectly getting at the clitoris. So the clitoris can definitely be affected by lichen sclerosus. Again, there can be symptoms like pain and itch. And in terms of kind of architectural changes, again, those basically mean changes to the physical appearance of your vulva. Lichen Sclerosus Support Network does have a blog on architectural changes as well as clitoral health, and our mod Kathy will drop those in the chat for anyone who is interested in learning more about that. So what can happen is that the hood of the clitoris, I'll make myself bigger here and I'll demonstrate this kind of more dynamically here with this puppet. The hood of the clitoris can partially or completely scar over, so fuse over this gland's clitoris. So if we have partial fusing, it might look something like this, where maybe you can still see a little bit of the glands, and if you try to retract, there's some movement. But what can also happen is complete scarring, complete fusing. So here, the hood completely scars over that clitoris. And so if you try to retract, A, you can't see the glands, but B, it's not really moving. And that's because the word, lichen sclerosus, lichenification, actually means skin hardening. So the skin gets really rigid and hard, and it's really difficult to move. So it's not as elastic, it's not as mobile. So that can get kind of stuck. And that is often called, in the medical literature, clitoral phimosis. Now, if you are watching either live or the replay and you have clitoral, fusing of any degree, and if that is causing you distress, there are absolutely ways that you can go about unfusing your clitoris, and we at Lichen Sclerosus Support Network have a ton of content on this. Again, Kathy is going to drop all of this in the comment section for you. Please feel free to read and watch that content at your leisure. So, for example, we have a video on non-surgical lysis of adhesions. That is with Kathy and Dr. Rachel Rubin. We have a video with Dr. Crew on clitoral myofascial release with myself and Dr. Crew for unfusing the clitoris. And then we also have a video which is three evidence-based ways, I should say, to unfuse the clitoris. So again, just some really important pieces to kind of read and watch and educate with respect to clitoral fusing. So we've kind of reviewed all of the parts now. So we're kind of winding down this education piece, getting ready to go into the appreciation piece. But before we go there, I just want to say a few more things. So one thing I want to say is that it is so important to celebrate vulvar diversity. All of our vulvas, there is no vulva that looks identical to another. They are all so unique. They come in different sizes, colors, shapes, etc. And if you are someone who thinks that they would benefit from seeing vulvar diversity, there are online galleries where you can look at real images of real vulvas of different ages and skin types, etc., to really see just how truly unique vulvas are. So if that does feel like something that would be supportive to your mental health and lichen sclerosus journey, there are a couple of resources. And again, Kathy will pop these resources in the chat. So the first one is a website. It's thevulvagallery.com. The second one is also a website. It's called labialibrary.org.au. And finally, recently, the Vulva Gallery published a book, which you can also purchase. It is a celebration of vulva diversity. So again, you can get that if that feels supportive to your journey. So as we kind of wind down this education piece, I just want to kind of pause here for a second and just, I've presented this education in a very clinical, very kind of straightforward manner, but I'm presenting this as a patient, and I'm presenting this as somebody who has experienced significant architectural changes to her vulva. And I just want to, acknowledge how very traumatic it can be for us to experience these changes, how traumatic it can be to look at our vulvas when we have lichen sclerosus, how scary that can be, how emotionally triggering that can be. And when we're in that space, it's really hard for us to appreciate our vulvas and to, feel compassion and love with our vulvas. And so because of that, we at Lichen Sclerosus Support Network today, we didn't just want to do education and awareness. We also wanted to have, an appreciation piece. And, we don't expect that you're going to do this little yoga meditation practice and immediately feel self-love for your vulva. That's not usually how it works. It would be great if it worked like a light switch, but instead, the way we kind of envision this is you taking your first step in your journey towards self-compassion and self-love and appreciation to your vulva. So don't worry if you do this practice and you're not feeling full of butterflies and love. That is super fair. That is super valid. You are just taking the first step to kind of getting towards that acceptance, getting towards that appreciation. So as we kind of wind down, if you want to start getting set up to do the appreciation practice, you'll want to have a place to lie down. So floor, yoga mat, bed, something like that, to do some gentle yoga and gentle movement as well as some meditation. Now, if you are feeling like you are in a flare, if you have an active tear, if you are in pain, and or if you're simply sitting here thinking, oof, I don't know if my body is ready for movement, that is okay. Instead of moving, you can choose to lie down, you can recline. If you're in a reclining chair, you can stay seated. But instead, I encourage you to close your eyes and just kind of listen to Penny's voice guiding us through this self-love piece, and really just remind yourself that you are carving out this time for you and your body. Just take some nice, big, deep breaths as we move through this. If you have any pieces that will help you feel more relaxed, like a candle or some essential oils, definitely feel free to incorporate those. So again, you can start setting up now, and in a couple of minutes, we will pop that recording on the screen. So just to kind of close officially this education piece, I just want to thank you all for showing up tonight, and for really showing up for yourself, right? Because what you did tonight was you carved out time. You carved out time to grow your awareness, to grow your education, and to practice appreciation and self-love. And that's really important because I think a lot of us, we lead very busy lives and we often don't prioritize ourselves. So really, I just want to thank you for showing up for yourself and for the community. If you learned something new in the education piece, if you appreciate, the vulva yoga and meditation piece, and you feel compelled to donate, your donations go to funding future events and programs such as this. Maybe don't do it now because you're probably lying down, but at the end, if you feel so compelled, there's a donate button up at the top. So after we play this video, I'll come back and I will close this out for the evening. If you have follow-up questions, we have a bunch of resources for you. We do host free bi-weekly virtual meetups where you can ask more questions. We also have a membership where you can ask your questions 24/7, and Kathy will put the link for the support meetup and the membership in the chat. We also have the Holistic Healing Summit, which is coming up very, very soon, May 8th to the 13th. This will be an opportunity for you to chat with medical providers, to learn from health experts, and to chat, ask your questions, get to know people, etc. Finally, you can also work with me one-on-one. I do offer one-on-one support calls. Kathy will leave all those links in the description, not the description box, but in the chat box. And now we are going to play Penny's recording.
My name is Penny, aka will be my Penny, and I am a pelvic floor yoga teacher. I'm super excited to be here today. Thank you so much for being here. I am so grateful. Grab a bunch of different pillows. If you have yoga props, you can use that as well. But I have a bigger pillow, and then I have a little smaller one, a little meditation cushion. We are going to get started. First off, just make yourself as comfortable as you possibly can. If you have water, I always recommend grabbing some water because hydration is key for a happy pelvis. And you're going to place the bigger pillow under your legs as you lie down on the floor. So you're placing the bigger pillow under your legs. And if you want a pillow under your head, you can go ahead and use one as well. Put the rest of your props to your side. And today I have created a pelvic floor practice for vulva owners. So we'll be focusing on the vulva today, and I'll be talking a lot about the vulva and really think about what you are struggling with when it comes to your LS. Is it your anatomy? Is there a certain part of your anatomy? For me, example, I struggle a lot around my perineum. So I bring my sense of love, healing, and just extra support to that body part. So if you feel that you are struggling mentally, emotionally, you can send love towards those parts of your being as well. So really find a little bit of an anchor today for your practice when it comes to your LS. So as you're coming down onto the floor, placing either one or several pillows under your legs. So paying attention, first of all, when you're landing on the floor, where is your pelvis in space? So when we land on the floor, we have a tendency to create a little bit of a deeper lower back arch. So maybe just pick up the hips, tuck the tailbone slightly, and then place the hips back down. But you want to make sure that you still have that little blueberry-sized space in your low back. So your pelvis is in neutral, like to say the pubic bone in height with the hip bones, the front of your hip bones. And then just release the arms alongside the body, maybe flipping the palms facing up towards the sky, just to open up the heart a little bit more. And feel into your body right now. Maybe guiding the legs a little bit further apart and let the feet fall out. Relaxing the shoulders away from the ears. And softly close down the eyes. And starting your practice today, take a big, beautiful inhale in through your nose. And open mouth release. Feeling your entire body, your entire being land on the ground. And really give yourself permission to let go of anything that isn't serving your practice today. Let go of anything that isn't serving you. And softly closing the lips. Connecting your mind to your breath. And continue to guide your inhales and your exhales through your nose. And without changing anything and without any judgment, just take a moment to notice your breath. Where are your breaths traveling to today? How are the inhales and the exhales feeling as they travel throughout your body? And on your next inhale, invite that inhale a little bit deeper, breathing in to the lower part of your rib cage, into your belly, and into your beautiful pelvis. With the inhales, inviting in space, inviting in healing. And with the exhales, continue to let go and find softness in your entire body, including your pelvis. As you continue to breathe into the lower part of your ribcage, into your belly, and into your pelvis, can you also send those inhales straight into your perineum, the space between the vaginal opening and the anal opening? Let the pelvic floor move with your breath today. With every inhale, your diaphragm, it expands and descends. And let the pelvic floor move with that descending. So feeling an expansion of the pelvic floor as you inhale, and relaxing as you exhale. And continue to breathe just like this. Let's see if you can send the breaths into your clitoris. Intentionally guiding the inhales in towards that part of your body. Sending healing, love, energy, whatever you may need. And with the exhales, continue to surrender even more. Fully relaxing your beautiful belly. And really come back to what you want to focus on today in your practice when it comes to your LS. Where do you want to send that healing, that love, that support, that energy? And with every inhale that you are taking from now on, imagine that you are inviting in all of that goodness. Taking another 3 deep pelvic floor breaths, feeling the expansion. And exhaling, relaxing. And then slowly placing the bigger pillow to your side and find a full body stretch. So you're extending the legs and guiding the arms above your head, inviting a big, beautiful inhale all the way down to your toes. And then exhale, hug the knees in towards the chest. Picking up your head and guiding your third eye towards your knees. Let the shoulders drop here and then place the head back down. Keeping the chin tucked and the neck long. You can either choose to stay in stillness or just start to rock a little bit from left to right. Checking in with your low back today. And then slowly finding some stillness, taking 2 deep pelvic floor breaths, breathing into your vulva. Can you connect with that expansion with every inhale? And relaxing with the exhales. And then placing your hands onto your knees, guide your knees towards your biceps. This is your modified happy baby. We're going to stay here for now. Really opening up here, so you're letting the knees come on the outside of the rib cage. Imagine that the tailbone is dropping towards the floor so that you are relaxing throughout your pelvic bowl. If you want to, if you feel comfortable, you can place a hand onto your vulva, onto your perineum. Once again, connect with your pelvic floor breathing. Can you feel your perineum pushing against your hand as you inhale? Feel free to close down the eyes, keep the eyes closed. Feel into the movements. And taking 2 more breaths. And guiding the legs back together, letting the feet land on the floor and guide the soles of the feet together. So coming into our butterfly pose, also known as bound angle. However, we're going to need some pillows here. So you're going to grab 2 pillows and you're going to place them under your thighs or under your knees, just to make it a little bit more restorative, and also being mindful if you live with hypermobility in this pose. Once again, paying attention to where your pelvis is in space, where your rib cage is in space. Are you flaring up? Can you maybe adjust yourself, placing your pelvis back in neutral? And option to place your hands onto your lower abdomen, or once again, place the hands onto your vulva, whatever you feel comfortable with. And inviting the inhales, the healing, the love, straight in to that lovely vulva of yours. With the exhales, letting go of any tension you may be holding on to in your pelvis, your hips, your inner thighs, your low back. And as we start to come deeper into our practice, into our hip openers, notice if you are clenching your jaw right now. Can you maybe wiggle it a little bit, unclench it, and maybe tuck the chin slightly if you've noticed that your chin has popped up towards the sky. Taking another 2 vulvar breaths, breathe straight into your vulva, into your perineum. And slowly guiding the legs back together. Placing the feet hip width apart. And guiding the arms out to a T, flipping the palms facing up towards the sky. I'm all about where the hands are placed. What are you inviting in as you land on the floor? Flipping the palms facing up, inviting in more loveliness. Picking up the hips, guiding the hips towards the right, and place the hips back down. Guide the legs in towards the chest, so you're kind of in a diagonal right now. And then you're going to release the legs over towards your left. So you're finding a twist, releasing the legs down. You can either just stay here, keeping that right arm out long, right shoulder on the floor. You can place a pillow under your legs, or you can place a pillow in between your legs to create some more space for your pelvis, for your lovely vulva. Close down the eyes and breathe into it. Fully melting into this lovely twist. And taking one more inhale. On the exhale, open mouth, release. Then guiding the legs back up to center. And moving the hips over towards your left, legs in towards the chest, and release the legs over towards your right. So you're finding your twist on the other side. Setting yourself up with your props as you see fit. I'm all about using the props to protect you, to support you, to make you feel good, to make you feel the best that you could possibly feel when you leave your practice today. Once again, fully letting go, breathing in through the twist, keeping your lovely belly relaxed. Taking one more inhale. And open mouth, release. Sighing out anything that might be stuck in your pelvis. And then releasing the props to your side, walking the feet back up to center, and the hips in line with the rest of your body. Rolling over to your favorite side, and coming up so that you are landing in a child's pose. This is an excellent time to grab some water if you want to hydrate a little bit. And if you are new to your child's pose, you're going to love this pose. This is one of my favorites. It's one of my students' many favorites. And if you want to stay in child's pose throughout the rest of the practice, I am totally fine with that. So you can choose if you want to guide your legs closer together or further apart. You're sitting onto your heels. You can always place a pillow under your bum and then release the torso down towards the floor. So either draping over your thighs or releasing in between your legs. You can place a pillow under your forehead or let the forehead drop all the way down to the floor. And grounding down through the fingers, the hands, the forearms. Let the tailbone drop towards the floor here. And can you intentionally start to breathe into the backside of your body? As I was saying in the beginning of the practice, breathing in to the lower part of your rib cage. This is where your diaphragm is located. Breathing into your lower back and into the backside of your pelvis, your tailbone, your sacrum, and also into your vulva. Notice what you are inhaling. As you are inhaling, can you use the breath to intentionally invite in anything that you want to see in your life when you leave your practice today? Taking another 3 deep breaths. And remember that you are muted. You can make as much noise as you want to with the exhales. Let go of anything that might be stuck. And then slowly moving into your tabletop position. So placing your hands slightly in front of your shoulders, knees under hips or a little bit wider. Today, as you move through your cat and cow, I will be demonstrating. Can you let your vulva lead this movement? So on the inhale, drop the belly, vulva coming up towards the sky, slightly gazing forward. And exhale, tuck the tailbone, vulva down towards the floor, creating space in the spine and between the shoulder blades. Inhale into your cow. And exhale into your cat. Moving at your own pace here. Feel free to close down the eyes. And feel free to exhale out through the mouth. And as soon as I stop talking, notice if it's easy for you to stay in your body, or if you find yourself wandering off, can you come back to your breathing? Taking another 3 deep breaths, fully connecting with those beautiful inhales and releasing with the exhales. And moving into your neutral spine. Beautiful. From here, you're going to reach for a pillow, a smaller pillow, a little bit more of a sturdy pillow. So if you only have soft pillows, maybe you can stack a couple pillows on top of each other. And you're going to place that pillow behind you. And you're going to tuck the toes. We're going to lean back into a deep yogi squat. And we're going to keep the feet parallel. If you want to open up a little bit, you do you. If you have done this pose before, I really love the parallel position. So shifting back, let the heels land on that pillow. Again, you might not need a pillow here today. Maybe your heels can stay on the floor. Maybe you're cool like that. I'm not. So let the heels sink into the pillow. The feet are parallel, toes are pointing forward. Knees are tracking the toes. And just let yourself hang here for a moment. Release the head. And release the arms. Can you send your breaths into your vulva, into your perineum? Feeling your beautiful belly pushing against your thighs. And take a moment to let your belly know how beautiful it is today. And as you continue to breathe into your vulva, can you sense anything starting to happen in your pelvis? Any release? Any tension that you're noticing is flying away, I was going to say, but diminishing? Taking another 2 deep breaths here. And then walking back forward into your table. Untucking the toes, maybe kicking through the feet a little bit. And connecting breath with movement once more. As you're back in your table, take a big deep inhale. On the exhale, shift back so you're sitting onto your heels in your child's pose. Inhale, coming forward into your table. And exhale, sit back. Moving at your own pace, maybe this time, can you let the tailbone lead the movement? Maybe finding a little bit of roundness as you're sitting back. And feel free to keep the eyes closed. Start to feel the movement in that little ball socket. Next time you come back, guide the big toes together and sit back into your child's pose. Letting the arms land alongside the body this time, flipping the palms facing up towards the sky. Drop the shoulders. Take 5 deep pelvic floor breaths, breathing straight into your vulva. And then slowly sitting back up onto your heels. Good. You're going to come all the way over so that you're sitting on your sits bones, guiding the soles of the feet together. So we're going to do our seated bound angle today as well. As you're coming to a seat, really pay attention to how you are sitting. So you want to find both sit bones. If you're struggling a little bit today, you can always place a pillow under those sit bones. This will lift you up a little bit, open up your pelvis, and keeping it open and long. You choose where you want to guide your feet today. The closer the feet are towards the groin, the deeper the stretch will be. So listen to what your body wants. Leave the ego outside. Doesn't really matter what the pose looks like as long as it feels good in your body. That's all that matters. Open the legs wide. Close down the eyes. And pay some more attention to your posture right now. So you're sitting on both sit bones. Spine is long. But your rib cage is still stacked on top of your hips. Drop the shoulders. Keeping the chest open. Tuck the chin slightly. And from here, placing your hands onto your vulva, if it feels good. Otherwise, groin or hip, inner thigh. Take a big deep inhale. And then exhale, brush out towards your knees. So inhaling, coming back. And exhale, brush out. Inhaling, let it go. And as you continue to do this, Imagine that you are brushing away all the freaking pain, all the discomfort, all of the itchiness, all of the tearing. Let it the fuck go. Feel free to exhale out through your mouth. Let go. Make some noise. Taking 2 more. And then let the hands land on your lower leg, ankle, whatever you feel good. And option 1 is to stay here in this energy. Notice the vibration of your lower body. Or take an exhale and hinge at the hips, coming forward as far as you feel comfortable with. So you're reaching out of the hips here. And then release the head. Still breathing into your beautiful vulva. Keep coming back to it. Taking 2 more breaths. And then slowly come back up, guiding the legs back together. Placing the hands behind and take a couple windshield wipers here. You can either keep the legs close together or guide them wider. Windshield wipers or hip flossers, releasing to one side, releasing to the other, releasing the low back. I hope that felt good. And then we're going to come all the way down to the floor, lying onto your back. Grab some more water if you want to. And as you come down onto the floor, hug the knees in towards the chest. And just rock a little bit from left to right. Placing your hands onto your knees, come to stillness, guide the knees towards your biceps. Option 1 is to stay here like we did earlier in our practice together today. This is your modified happy baby. If you want to come into a non-modified happy baby, you can do that as well. Know that no matter your choice today, you are doing fantastic. So if you want to come into a non-modified, stacking your ankles on top of your knees, grab a hold of the ankle or the outside of the feet, a little bit closer towards the pinky toe, but you're not hanging on the pinky toe. Imagine that you're putting your footprint on the ceiling. The knees are coming on the outside of the rib cage, so they're not towards the chest. If they're coming on the outside, you're opening up more in the pelvis. It will also become a lot easier for you. Again, let the tailbone drop towards the floor. Here you can use your breath, visualization to let that beautiful tailbone drop down. Tuck the chin slightly. And moving with your breath, continue to breathe into your vulva. Maybe start to rock a little bit from left to right. So now we're really starting to open up here. Relaxing the shoulders, your jaw. Breathing into your very beautiful belly. And then find some stillness. Taking another 3 deep vulva breaths. And then releasing the legs down towards the floor. Oh yeah, probably feeling the openness in your hips right now. I'm going to give you the option today to either come into your Shavasana, your beginning meditation. We're going to do that at the end as well, where you place your pillow under your legs, or find your meditation in a fallen bridge pose today. A fallen bridge pose is walking the feet about mat width apart. Let the toes point in slightly and then release the legs against each other. And no matter where you land, maybe create it's called a womb mudra, but it doesn't really matter if you have a womb or not. We're creating a diamond shape with your hands. So the index fingers come together, and then the thumb. Creating a little triangle, placing that triangle on your lower abdomen. Maybe the fingertips are touching the pubic bone. Closing down the eyes. And really let your pelvis melt in to the earth. Let your pelvis know that it's safe to relax. It's safe to be vulnerable. It's always supported. And relaxing the shoulders, reconnect with your breath. Mindfully guiding the inhales all the way down into your perineum. And with the exhales, fully relaxing, letting go. And just check in with yourself right now. How are you feeling right now compared to when you started your practice today? How are you feeling physically? How are you feeling mentally? How are you feeling emotionally? And what is your energy like right now compared to when you started your practice today? What is the energy like in your pelvis, in your vulva, in your entire being? No matter what you are feeling right now, I want you to know that you are absolutely freaking fantastic for showing up for yourself today, for showing up for yourself all week. The way that you're supporting your body right now, your body's going to support you right back. So send some gratitude to your body, to your pelvis, to your very beautiful vulva, labia or not. Send it some love, some gratitude, some appreciation. we're going to finish our practice together today by taking 3 deep breaths. Feel free to make as much noise as you want to. Inhaling deeply in through the nose. And let it go. Inhaling. Release it all. One more. Biggest inhale of the day. And the most cleansing exhale. And then slowly start to bring some movement back into your body. Wiggle the fingers, the toes, rocking the head from left to right. And slowly rolling over to your favorite side. And making your way up to a seated position. Once seated, find both sit bones, a long spine, an open chest, and an open heart. Inhaling the arms up towards the sky. And exhale the hands down the midline. The light in me honors the light in you. Namaste.
All right, everybody. Thank you so much for showing up tonight, for showing up for yourself, for showing up for the community. If you are in a restful position, feel free to stay there as long as you need. We thank you again. If you found this event helpful, please let us know. We appreciate your feedback. If you learned something new, if you appreciated this vulva awareness piece, please, if you feel compelled to donate, please do so. Your donations go to fund future events such as this. And with that, I want to just close by saying you are beautiful, you are worthy, and your vulva deserves love. Thank you so much on behalf of LSSN, and we are wishing you a beautiful day.